Hello there, welcome to another really short video about building your core strength, I guess, after having a baby. So this is definitely not for you if you are pregnant, but is really useful for people that are postnatal. Now this is a slightly more advanced movement because we are working with the core with our feet away from the floor, but I just wanted to share this with you because it's a movement that I see a lot prescribed by people on experts in pre and postnatal exercise, but there's a huge amount of room for error with this one in terms of how the core properly functions, how your breathing works, but also for a lot of people when I cue this movement, a lot of them, when they aren't quite getting the technique right, they get a lot of pain in their hip. And this happened to me yesterday, and we tried another move and it completely took away the hip pain and also got a lot more core engagement. So I'm going to share that with you today. So I'll show you the movement and then I'll explain why it works. But basically what you're going to do is you're going to come onto your back with your feet flat on the floor, first and foremost. Now from here, you're going to take one of your diaphragmatic breaths in, so that's thinking about breathing into the rib cage and allowing the whole of the rib cage to expand. So for some of you, you might want to take the hands onto the rib cage because that's really helpful. We close the mouth, we inhale through the nose, and all you're going to do is take that long exhale with the jaw dropped and think about either the diaphragm pulling the stomach up, or this idea of, as you exhale, the hip bones coming towards one another, and what you should start to feel is this whole piece from the bottom all the way to the top of the core starts to engage. You're then going to use that breath to move your legs. So I always start with a long exhale when I do this, so that I can feel the engagement through my core. Then I inhale through my nose. And then on the exhale, all I'm going to do is lift one foot away from the floor. Then I'm going to hold that here, take a deep breath in. And as I exhale again, I'm going to lower down. Take a deep breath in. Exhale, think about the stomach being lifted up by the diaphragm, lift the opposite leg. Another deep breath in. Exhale, and as you do so, lower down the leg, maybe thinking about the hips drawing towards one another to get that engagement through the core. And all you do is repeat that movement. But for some people, I could feel it then because my right hip is a prime suspect for this. But I could feel that my right hip felt like it was either going to, mine feels like it's really tight, like something that just doesn't feel right. What my client said to me yesterday was that it felt like a hip was going to pop forwards or pop back. Now, one of the reasons for this is because we generally, as a population, like to stand on our right leg more than our left, and that pushes the femur bone forwards a little bit, and it also encourages the right femur to turn inwards. And really, in order to walk and do all the movements that we like to do biomechanically, we need good external rotation through our right femur. So sometimes when you do that movement, if you're getting a lot of pain through your hip flexor, it might be because your right femur just needs some guidance. And the way you can guide it is this. So you'll notice I've just put one sock on. That's because I need a slippy heel. And what you're going to do is, and what I got my client to do yesterday was put her right foot on the floor, and I got her to do a hinge. So when I'm talking about a hinge, it means the tailbone's back, the crown of the head's forwards. You've not got a massive curve in your back. You're looking for a nice straight back, and we've got quite a lot of lengthening happening through the hamstrings because our big toes are down. You could also do this standing straight and holding onto a banister, but because I knew my client well and I know that she's got this hinge, this is going to help to work her core a little bit more as well whilst we're doing the foot. So if you can hinge, great, do the hinge. If you're not sure about the hinge, then maybe you do this standing. You're going to need your left knee to be quite soft, and then all you're going to do is the right foot needs to be in line with the left, so the toes need to be in line with each other. And all you're going to do is guide the right heel out to the side, take a deep breath in, and as you exhale, you're going to pull that heel as far round as you possibly can without moving the toe. So you can see I moved my toe then first. But your toes need to stay really, really still, as in they don't turn out, they just stay facing forwards. The heel goes right out. Take a deep breath in, and then as you exhale, you're driving just the heel down. So there's loads of pressure through the ball of my foot. My heel then slides back out. Big breath in. Exhale. Slide the heel back round. So you should feel this a little bit in the hamstring, especially if you've got the hinge. You might, if you're doing it with a hinge, feel your core as well. If you're stood up, you're definitely going to feel it through your adductor, your inner thigh, and you might feel a little bit of glute, or possibly like underneath where your bottom should curve, your glute there. And then, really simply, we can test if that's worked by doing that movement again. So, from a slightly different angle, feet flat on the floor, take a deep breath in. As you exhale, lift the right leg, take another deep breath in. As you exhale, lower the foot. Think about the stomach being sucked up by the diaphragm. And yet that pressure that I felt before is now gone. So I've created a little bit of space in that really tight hip flexor by waking up my hamstrings basically and encouraging my femur to rotate out rather than drawing in. That will work for you if when you squat, you notice, or when you lunge, you notice that your right leg likes to pull forwards a little bit. Mine does this all the time. So if I was to do a lunge, my knee naturally wants to pull in here. So by thinking about anchoring into the heel and just pulling it round, that guides the knee back out into a straight position rather than it being knocked in. So useful tip, really great exercise for engaging the lower abdominal muscles. If you've had a C-section, you want to make sure that you're not going to do this movement for a long time. There's other things with breath work that you need to do first, and I'll link some of those videos once they're up on Substack. I'll link them here for you to find. So if you've had a vaginal delivery and you feel really well, you could start to do this kind of movement around about 12 weeks after giving birth. If you've had a C-section, you need to wait for a little bit longer. Make sure you've not got any pressure through the scar when you're doing the diaphragmatic breathing, and then you can start to layer that in. But I wanted to share it with you because it really worked for my client yesterday, and if it's something that I'm experiencing in class, then it's definitely something that you guys will be experiencing at home. As always, if you found it useful, let me know. If you found it difficult or you feel as though it hasn't really worked for you, then tell me why, and I will try and help you out in the comments.